So, your doctor has just ordered a medical scan, and you might be feeling a little, well, uncertain. What's it going to be like? What exactly are they looking for? In the next few minutes, we're going to demystify this whole process and help turn that uncertainty into confidence. And that's really the core of it, isn't it? The unknown can be unsettling. But knowledge is such a powerful tool. By the time we're done here, you're going to have a much better handle on what these incredible machines do, and more importantly, what to expect if you're scheduled for one yourself. Okay, so here's our game plan. First, we're going to tackle that feeling of the unknown head-on. Then, we'll get into what diagnostic imaging actually is. We'll spend most of our time comparing the three big ones: MRI, CT, and ultrasound. After that, we'll walk you through a typical appointment, and finally, we'll peek behind the curtain to see how you get from images to answers. All right, first up, answering the unknown. Before we even get into all the technology, let's start with the most important part: easing your concerns. Our goal here is pretty simple: to help you feel prepared and way less apprehensive about the whole thing. Okay, moving on. What exactly is diagnostic imaging? It sounds super technical, but really, it's all about giving your doctor a window into your body. Let's break down what that means. At its heart, diagnostic radiology is just about creating really detailed pictures of what's going on inside you. And the keyword here is non-invasive. It's an absolutely incredible way to get answers without having to do something like surgery. And this is the amazing result. These super detailed images give your care team an incredibly clear view of your bones, organs, and tissues. It lets them see exactly what's happening inside you without ever making a single incision. So why would your doctor order a scan in the first place? Well, it could be to get an initial diagnosis for something like a broken bone or some unexplained pain. Or it could be to monitor an ongoing condition, to see if a treatment is working. And sometimes it's to help plan out the most effective next steps for your care. Now for the main event, let's dive into the three workhorses of medical imaging: MRI, CT, and ultrasound. You've probably heard these names thrown around, but what's the real difference between them? Let's find out. The answer to this really depends on what part of your body your doctor needs to look at and what they're looking for. Each one of these technologies has its own unique strengths. First up, the MRI. The most important thing to know is that it does not use any ionizing radiation. That's the kind of energy you find in X-rays. Instead, it uses a super strong magnet and radio waves to create unbelievably detailed images. The process is completely painless, but I will say the machine can be kinda loud, so they'll almost always give you headphones to listen to music. So, when is an MRI the best choice? Well, it is the absolute gold standard for looking at soft tissues. Think of things like joint injuries in your knee or shoulder, issues with your spine, or investigating neurological symptoms. When your doctor needs the absolute highest level of detail on those kinds of structures, an MRI is usually the answer. Next, we've got the CT scan. A CT scanner uses a very narrow beam of X-rays that rotates around your body. Then, a computer processes all that information to create these detailed cross-sectional images. A good way to think of them is like individual slices of your body that can be stacked up to create a full 3D view. So here you can see the machine itself, that classic donut shape on the left, and then on the right, you see the kind of incredibly detailed slice images it produces. One of the biggest pluses of a CT scan is speed. A whole scan can take just a few minutes, giving doctors amazing clarity fast. A CT scan is amazing at viewing dense structures like bones, which makes it perfect for checking out fractures. It's also extremely useful in urgent situations like a head injury or if doctors need to look for blood clots in the lungs. It gives them the info they need to make fast, accurate decisions when it counts. And finally, we have the ultrasound. Just like an MRI, this scan is totally radiation-free. It uses high-frequency sound waves, way beyond what we can hear, to generate live, real-time images. It's almost like a video of what's happening inside you at that very moment. Now, we all know ultrasound is used for monitoring pregnancy, right? But it's also excellent for looking at abdominal organs like the liver and kidneys, checking the blood flow in your veins, and investigating any weird lumps just under the skin. It's safe, painless, and just really effective for looking at soft or fluid-filled parts of the body. Okay, this table really puts it all together. The biggest takeaway here: no single scan is the best. It's always about picking the right tool for the job. Just look at the technology row. You've got magnets, X-rays, and sound waves. That's why they're best for totally different things. MRI for soft tissue, CT for bones and emergencies, and ultrasound for organs and pregnancy. It's like a specialized toolkit for your doctor.
Okay, we've covered the what, so let's move on to the how. In this section, we're going to walk through your imaging appointment step by step, so you know exactly what to expect from the moment you walk in the door.
Your whole visit can really be broken down into 4 simple steps. You'll start with check-in, easy enough. Then, a member of the imaging team will get you ready. That might mean changing into a gown or maybe placing an IV for contrast dye if it's needed. They're there to answer any last-minute questions you have. Then comes the actual exam, where the imaging professional will guide you through the scan, giving you clear instructions. And finally, before you leave, they'll let you know what happens next.
All right, our final section, from images to answers. So you've done your scan, you're headed home, but what happens now? This is where some really crucial behind-the-scenes work begins.
And this is so important to remember. Just because your visit is over doesn't mean the work stops. Behind the scenes, a whole team of people continues to work on your behalf to find the answers you and your doctor are looking for. Your images are sent to a subspecialty radiologist. You can think of them as a detective for the human body. This is a doctor who has spent years training specifically to interpret images of, say, the brain or the knee. They are an absolute expert at spotting even the tiniest details in these exact types of scans. So after their detailed analysis, the radiologist creates a full report. That report is then sent straight to the doctor who ordered your scan in the first place. Your doctor will then share the results with you and talk about what the next steps are in your care plan.
And that's really the bottom line. From the person who greets you at the front desk, to the technologist right there by your side during the scan, to the expert radiologist analyzing your images from afar, everyone is part of a dedicated team focused on one thing: you. We really hope this has helped demystify the process and left you feeling a little more prepared and at ease. Thanks so much for watching.